Welcome back to Tales from the Lab, a veterinary podcast. I'm Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antech. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Tales from the Lab is a production of Antech Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.
Welcome back to Tales from the Lab. I'm Dr. Brad Ryan. This is the case of Drake, and Drake is a 3-month-old Goldendoodle puppy whose illness ultimately required for him to be hospitalized. Specialty consultation, serial PCR monitoring, and important communications with owners along the way. And just incidentally, this is a case that I heard about firsthand when I was working as a professional services veterinarian in Asheville, North Carolina, Holly.
And Brad, what I think makes this case especially relatable is that it really reflects day-to-day general practice medicine. We've all seen cases like this, and they're not just straightforward, obviously. We're always nuancing our treatment and diagnostic recommendations. In this case, there are financial limitations to take into consideration. The patient experienced treatment failures, and just even having a very sick pediatric patient, right, always tugs on heartstrings for both the pet owner and for the team who's trying to make the right diagnostic and medical decisions while also supporting that very worried family.
These are situations that we see almost on the daily in private practice. And I think that's what makes this case so important for everybody to hear today and to share. And so let's jump into it. Drake was a 3-month-old male Goldendoodle puppy who had recently been adopted from a breeder in Florida. So this family came from Florida, and about 10 days later, the family relocated to Asheville, North Carolina. So what happened while he was still in Florida is that they went to his private practitioner, and he had some bloody stool. And at that point, Drake had been diagnosed with hookworms via fecal flotation and then treated with fenbendazole. So pretty standard. We've all done that, right? But despite the treatment, he continued to have this 10-day history of bloody diarrhea, intermittently not eating, lethargic, poor appetite, clearly a little bit nauseated. So the previous veterinarian had prescribed some ondansetron and metronidazole to support him, but Drake frequently was vomiting those medications back up. So he wasn't even keeping those down. And of course, they're trying to move on to their new stage of life. And the entire time that they're moving, this poor little puppy is still having diarrhea every day.
Just can't imagine them dealing with that on top of the stress of a move. And several things immediately stand out, right? So we have a really young puppy with significant GI disease. He's gotten himself likely dehydrated, right? And ongoing blood loss when there's not that much blood pool to begin with in this young pediatric patient. But also now not responding to what would normally be considered appropriate therapy for the diagnosis, right? As you said, we see hookworms all the time in practice, right? And usually we have a pretty routine standard treatment. And often we get great clinical response. And I'd say historically, we're not even often rechecking some of these, probably as frequently as we should.
I think we should be rechecking, in accordance with CAPC guidelines, we should be rechecking any hookworm positive case to make sure that the treatment that we administered was effective. But that's we'll come back to that a little bit later. But you're absolutely right. This definitely raised concerns that we might not be dealing with your quote unquote status quo routine hookworm case here with Drake. So let's get back into the exam room in Asheville, North Carolina. So on presentation, the veterinarian could see that Drake was clearly really, really sick. He had a body condition score of 3 out of 9. The vet estimated that Drake was probably between 5 to 7% dehydrated. She could tell that he was lethargic, nauseated. There was some hypersalivation there to support that. And then actively having this watery, bloody mucoid diarrhea actually right on the exam table during the physical exam. On abdominal palpation, the intestines felt diffusely thickened, although there was no obvious focal foreign body or palpable mass that she could detect there.
And I think that's an important point because while parasites remain very high on the differential list in this puppy and in any puppy, the diffuse intestinal thickening does broaden things a bit, right? There's a true tissue change that she's feeling there. And I think we still would have to consider in this case infectious enteritis, other inflammatory conditions. dietary discretion. A young puppy, especially during a move, you can imagine might have access to things they're not maybe picking up every little bit and piece that's around them at the time. Other ingested foreign material. And then, of course, always in a young puppy with bloody mucoid diarrhea, thinking about parvovirus.
And you're exactly right, Holly, because these puppies can decline so quickly. So it's so critical that we get that useful diagnostic information early. So here we go. Let's jump into the diagnostic plan. So right now, I think we're all thinking probably along the same lines here, right? So this veterinarian has drawn some blood for a CBC and chemistry profile. Yes, we did an in-house parvovirus ELISA test. And in this case, a KeyScreen GI Parasite PCR panel, along with a recommendation for abdominal radiographs, which were initially declined by the owner, just based on financial concerns. But we're going to get that blood work, we're going to have that parvo test, and we're going to see this PCR result. So I think you would agree, Holly, this is a realistic example of spectrum of care medicine. Yes, if we could have done everything, we would have done it, but I think they prioritized the right tests at this stage in the game. So we have to always do that. We have to prioritize diagnostics based on what owners can reasonably pursue financially at that time, while making sure that we are giving it our best shot, or our most reasonable chance at getting the most clinically useful information.
Yeah, exactly right. Contextualizing and prioritizing the diagnostics based on owner and patient specific factors that are going to vary for every individual case, right? Every individual owner or pet, depending on their condition, the family life, other pets in the household, you name it, right? All of that comes into consideration. And that does include what the owner can reasonably afford financially, right? And tying it all together to try to be judicious, maybe, in our diagnostic tests of selection, and giving the owner, of course, input into that, making a collective decision with the veterinarian.
So the initial laboratory findings showed, no surprise here, an anemia, a leukocytosis, a thrombocytosis, and hyperglobulinemia. Fortunately, the in-house parvovirus ELISA was negative. So we know at least at this point that we have a lot of support here for severe inflammatory GI disease with ongoing blood loss and substantial immune stimulation.
And that's a lot of change for a young puppy to see in the lab work, right? That there really are significant tissue and systemic changes that we have evidence for. And the thrombocytosis, likely reactive in this case, right? Given that we have the ongoing GI bleeding as well as inflammation from a presumed, at this point, parasite burden. And the hyperglobulinemia, right? Given that inflammatory, infectious process and the immune stimulation in a very young, naive immune system.
So at this point, we have a lot of support here for severe parasitism. That's going to be high on our differential list at this point, although we don't have that KeyScreen result yet because that's a 24-hour or less turnaround time. So we're not going to get that today. This is a Saturday, by the way, at this clinic. So just keep that in mind. We have to wait on that information. But the major concern here is still the fact that we have all this supportive evidence for parasitism, and we have this history of a lack of response to that fenbendazole that was prescribed by the veterinarian down in Florida. So where are we? The veterinary team assessed that Drake has progressive gastroenteritis and colitis that was worsening despite that treatment of fenbendazole that was given by his initial consultation in Florida. So severe parasite infection remained the top differential, although infectious, inflammatory, and obstructive causes still have to remain on the differential list at this point. So emergency hospitalization was recommended because of Drake's dehydration, anemia, and his inability to tolerate those oral medications. But the owners declined ER transfer, once again, due to cost concerns, which I think is something that we run into quite frequently in private practice. So instead, the team pursued outpatient stabilization with IV fluids and supportive care before discharging Drake with anti-nausea medications, metronidazole, and instructions for small frequent meals using a sensitive stomach diet as the weekend plan of action.
Thought the communication piece here was especially well handled because the team made it clear that Drake required close monitoring, right? That the owner was then taking that upon themselves, given that we are not going to send him for hospitalization. And that if the worsening anemia was certainly a concern and transfusion or referral could indeed become necessary if he deteriorated further.
So the following day was a Sunday. The practice wasn't open, but this is a great doctor who keeps close tabs on all of her patients. And the KeyScreen GI Parasite PCR result came back. And this was really the turning point in the case. And for those of you who use the test, you're already going to be looking ahead to what we're about to say. But the panel detected ancylostoma hookworms along with the molecular marker for benzimidazole resistance. So this is specifically the drug class that Drake had already received in Florida. So makes perfect sense here, right? Suddenly the entire clinical picture was coming into focus. Drake wasn't failing treatment because the diagnosis was wrong initially. He was failing because the hookworms themselves were resistant to fenbendazole, the drug that was given.
Right. And so the diagnosis was not wrong, but it was incomplete, right? Because without those molecular diagnostics, right, it could look like refractory inflammatory bowel disease, a dietary intolerance, any other treatment failure. In truth, right? But the beauty of having KeyScreen and just to fill the audience in if they're not familiar with the test, right? So a PCR-based test looking for GI parasites. So going beyond just the ova and maybe some of the Giardia or something that we might see on a fecal flotation or on a smear, a fecal smear that's stained. In this scenario, we're actually looking for genetic material, right? So far more sensitive screening and a full panel of GI parasites. Again, not just those nematodes that shed ova intermittently, right? Increase the sensitivity in the breath of the GI parasites that we're looking for, but then even better, once we have that genetic material, right, then we can look into that a little further. And so KeyScreen has currently a couple additional tests based on having that genetic material. And one is to look for this treatment resistance, right? Look for this resistance gene to indicate that we have some drug resistance in this hookworm population, which I know you can speak to because we are just definitely seeing it much more commonly. Also, for those who get frustrated by recurrent Giardia infections or seeing positive Giardia fecal results, getting to see whether or not that they have the zoonotic assemblages that can help guide treatment decisions in those cases.
And historically, fenbendazole has always been a very reliable treatment for hookworms, and I would say remains probably the mainstay that most veterinarians are reaching for to this day. But we have seen this story across North America change very rapidly, very dramatically in the last decade or so. And resistant ancylostoma caninum strains are becoming increasingly prevalent in certain regions and breeding populations. When I started at Antech 5.5 years ago, I was hearing, isn't that just a Florida problem? But I don't hear that very much anymore. I think this has shown up in most clinics across the country.
Right. And I think, correct me if I'm wrong, Brad, but I think it was something in the KeyScreen data seeing that maybe 11%, somewhere around 11% of ancylostoma positive findings did have the resistance
That
gene.
was our first study that was peer-reviewed and published that looked at approximately 300,000 fecal samples in the first 10 months that KeyScreen was on the market. And it was available as a screening option for fecals. 300,000 random samples, very robust data set at the time. And I should also note that study was also just looking at the F167Y drug resistance gene for benzimidazole. We knew that we were still missing some of those cases, and we added an additional marker called Q134H. I know that's getting maybe a little bit in the weeds there, but I think it's just interesting because that 11% number certainly would have been higher, we would assume, if we had been screening for both of those markers. And stay tuned for more data.
Yeah, and I don't think that's getting in the weeds. I think it's important to also realize that we're constantly innovating, right? That as more of these resistant genes are identified, we can easily incorporate them into this panel PCR testing.
So it is now Monday morning. Drake has not gotten better over the weekend, still lethargic, still dehydrated, ongoing bloody diarrhea, pale pink mucous membranes upon presentation at the hospital that morning. So the veterinarian does repeat diagnostics, which showed that the anemia was getting worse. The PCV is now down to 18%. The leukocytosis and thrombocytosis has persisted, reinforcing the severity of that inflammatory process that's going on here. The electrolytes remain normal, and now we had a few days to sit on it, and the owner has agreed to do some abdominal radiographs. Turned out to be unremarkable, but we still were able to rule out some important differentials. Top of mind is obstructive disease, right? So at that point, the veterinarian and her team are feeling increasingly confident that the resistant hookworm infection is the primary driver of Drake's illness here. Because Drake remained unstable, he was hospitalized for critical care support, including IV fluids, antiemetics, GI support, nutritional management, and close monitoring. So our standard of care for patients that are dealing with this level of dehydration from chronic diarrhea and from blood loss. So one of the strongest decisions in this case that this veterinarian happened to make was consultation with a board-certified veterinary parasitologist. And that collaboration helped guide a much more targeted treatment plan specifically designed for benzimidazole-resistant hookworm infections like the one that was diagnosed on KeyScreen for Drake. So this protocol included a topical imidacloprid plus moxidectin every 2 weeks initially, along with a topical combination therapy of praziquantel, parental, and fabantal. So that plan included serial KeyScreen PCR monitoring, which is key here, with the understanding that Drake would not be considered cleared until he achieved 3 consecutive negative PCR results. So we've got a long way to go on this case. And I think the important thing here just to say is always set owner expectations accordingly. Like, this is the time to have that conversation. We have a long way to go here, and it's going to be a long haul before we finally, in most cases, are going to get to that undetectable result and that glorious day when we can say that we've gotten through the worst of this.
Yeah, and I think it highlights an important point for practitioners is that these resistant parasite cases, as we make these diagnoses and we are handling these patients in our practices, is that you are not alone, right? That we are really lucky in practicing in today's day and age where we do have access to specialists, right? Antech has their consultation services to reach out when you need help, right? This is for many people, if you haven't run KeyScreen before, this will be your first experience with seeing some of these treatment-resistant hookworm infections, right? And so you're not alone in your treatment. Reach out to these specialists so you can dramatically improve treatment success and confidence in this case management. They're there to help support the diagnostic test results.
So his hydration status improved, his PCV increased, but he was also just becoming a little bit more responsive throughout the day, eating a little bit, not a lot, but enough to give us a little bit of hope that he was feeling better. And those moments are always rewarding, obviously, when we've got this critically ill puppy in front of us, that once we start that supportive care and we get that targeted therapy going, that's in alignment with the underlying disease process, that we can start seeing those improvements quickly. But we were by no means out of the woods here because this was a very, very sick puppy. So what this veterinarian was able to do for Drake on the spot was to give that oral praziquantel, parental, fabantal product. The multi-drug resistant hookworm drug treatment protocol also includes a topical imidacloprid moxidectin product that she just didn't have in stock at the hospital. So she had to order that, which is going to come back into the conversation here in just a second. But what she was able to do was give that oral praziquantel, parental, fabantal product, probiotics, and then sent the puppy home with some antiemetics. And then we had to wait for that topical product to come in. And so a couple days later, when the owner did come in to get that topical imidacloprid moxidectin product, Drake had been so sick the last 2 days that the owner was actually considering having him euthanized that morning. He was so ill. And we can just imagine kind of the heartbreak that owner was witnessing in those 2 days. But once again, super important to note that we had a rock solid diagnosis here of a benzimidazole resistant hookworm case beyond just identifying the parasite itself. And because this veterinarian had confirmed those resistance markers and could pursue that evidence-based treatment recommendation from the specialist consultation that she did, she was able to stand a little more confidently that morning and talk the owner down from that panic that she was experiencing. The owner agreed to go ahead and continue the treatment. The veterinarian went ahead and administered that topical imidacloprid moxidectin product right there in the hospital and sent Drake home. And fortunately, everything started to change at that point.
Right. I mean, without that diagnostic clarity given the confidence in the test results, that conversation and that appointment that morning could have unfolded very differently. Right. And this is again, these aren't just one-off stories. And I think the more people take advantage of some of these advanced diagnostics and use them appropriately in these cases, they will make life-saving differences. And we talked about an earlier case of it happened to be KeyScreen again, but in a cat that we had at my practice, and the cat was dealing with what seemed like an irretractable IBD, right? That they couldn't get resolved with a loss of quality of life. And the cat was suffering, the owner was suffering. And despite multiple different types of therapies and trying to get that under control, and it ended up being a trichomonas infection, right? And again, until you get the right drug for the right bug, there can be a lot of morbidity, right? And that can lead to some really difficult decisions around quality of life, right? So really the power again of those diagnostics.
Drug resistance in a variety of infectious diseases has completely changed the game in human medicine and in veterinary medicine. And we're talking about multi-drug resistant hookworms here, but obviously that's just tip of the iceberg of what we're already dealing with across the landscape. And we're going to have to continue to watch this evolving story over time. I start this conversation in every veterinary hospital with every veterinary team looking at an image of hookworm eggs under the microscope, and everybody can identify that they're hookworms. And then I, in a very tongue-in-cheek way, ask, do we want to use benzimidazoles on this particular hookworm case? Is that what's going to kill the hookworm, or do we need to do a multi-drug treatment protocol? And of course, the DNA is the only thing that's going to tell us the answer to that question. And I think that is the jumping off point for a conversation I would like every hospital to have if we're really looking honestly at those CAPC maps in our community and seeing just how quickly the story is unfolding, not just across the country, but oftentimes the story is unfolding in a very dramatic way in our backyards and our counties, which we can find that information on CAPC as well. At this point, the veterinarian followed up with Drake's owner the next day, and it was like night and day, even within 24 hours. But Drake didn't come back into the hospital for a reevaluation for another 3 weeks. And the transformation was just completely inspiring and dramatic. He was bright, active, hydrated. He'd put on a lot of weight, normal body condition score, and no reports of any bloody diarrhea at all for pretty much since the topical drug had been given that morning, 3 weeks earlier. So we're really happy with how Drake looks this morning, and we are here to do another KeyScreen PCR test as a follow-up. And just so everybody who's listening knows, the current recommendations right now are to retest any patient who tests positive for hookworms 2 weeks after you give the treatment to evaluate that treatment efficacy, and then 3 to 4 weeks post-treatment to evaluate larval leak. And because of larval leak, I will say once again, it's one of the most important things to remember when you're looking at rechecks on KeyScreen, particularly for hookworms. They're kind of their own special one-off because of larval leakage, that part of their life cycle, that phenomenon. So getting an undetectable result on your first recheck in most cases is probably not very realistic because of larval leak. These are cases that can feel a little overwhelming, a little complicated to monitor, especially because we're looking at burdens of DNA as opposed to egg counts, which a lot of us are more familiar with, although those are, in my experience, rarely utilized in private practice. But at any rate, take advantage of your professional services veterinarians, take advantage of that internal medicine consult line so that you can get guidance on those cases. And I hope that you don't see very many, but there are rare cases where the multi-drug treatment protocol doesn't work and there are off-label recommendations that need to be pursued. Never start there. And with those off-label treatments come breed safety considerations, dosing considerations. So work with our consult line. We're here for you to provide that support, that peace of mind, and get you the clinical outcome that you're hoping to get. Ultimately, after continued therapy and monitoring, Drake achieved a fully negative KeyScreen result. It was almost 2 months, I should add, after his initial presentation at the hospital. But the important part here is that clinically, he got better when he was given the right treatment. But it did take several KeyScreen rechecks before we finally got that undetectable result. So this case highlights several important themes that we just want to close on. So just as a reminder again, drug-resistant hookworms, not just a greyhound problem, not just a Florida problem, now considered a full-blown issue that we see across North America. So emerging parasite resistance is something that we need to keep our eye on, and we need to stay educated about how that story is evolving over time. This case also highlights the value of molecular fecal diagnostics. We've been diving deep on those benzimidazole-resistant markers for hookworms, but there are a lot of other parasites on here that don't routinely show up on other diagnostic methods, including fecal flotation, most namely. But also zoonotic assemblages of Giardia, that's on KeyScreen as well. So just keeping in mind that there are limits to what we can learn about a patient's parasite status just from a fecal float alone. And then clearly the importance of serial monitoring to make sure that we're on the right track with our therapies, and collaborative medicine, of course. This veterinarian would not have known what drug protocol to use and what diagnostic recheck timeline should be adhered to, had it not been with that consultation with a parasitologist who was guiding her on those next steps. And finally, the impact diagnostics can have on both treatment decisions and client communication. I think this case illustrates all of that and a whole lot more.
And at the risk of sounding too dramatic, I mean, it really did save his life, right? Drake's life was saved because of that and because of the communication around testing diagnostic and opportunities. They had the collaborative decision making and then the confidence that clinician had given the right diagnosis to tell them to, I think if we stick it out, right? I think we get the right treatment on board, that we're going to see appropriate recovery. And indeed, they did.
Yeah, I think that's why this has stuck with me all these years. I met this veterinarian and heard about this case about 3 years ago, but I still haven't really encountered a more poignant case, I guess, in terms of just that relatability of watching an animal that you love suffer to the point that you're considering euthanasia, and there's something that we could actually do that was not expensive. It was such a simple fix, but we needed that information. And without KeyScreen, we wouldn't have, I mean, maybe we would have gotten there by taking a longer road, but I don't think so in this case because he was so sick.
Yeah, I don't think we had a longer road, right? Unfortunately, right? Yeah, both for his suffering and I think the suffering that the owner was experiencing that had driven her to the point of considering euthanasia, right?
Yeah, I was always passionate about KeyScreen. From the second that KeyScreen was launched, I've held my head high and I've stood confidently in front of many hospitals and advocated for this standard of care. But learning about Drake's case made me stand that much taller. And knowing that this really does make a difference. And this can, as you said, save lives. Absolutely, I believe that. So thanks for all of you who are tuning in, for joining us for another episode of Tales from the Lab. We'll see you next time.
Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here.